So we've already talked about some of the other options of treatment for disc herniations and foraminal encroachment, but I didn't talk about how ART can help out with this type of thing. That's what I'm going to do right now. Alright, so ART is a very specific type of soft tissue treatment. It's considered the gold standard of all soft tissue treatments. It's used widely by many different athletes from the NBA, NHL. A lot of Olympic athletes use it as well. But a lot of people don't know that it'll help this type of thing for a normal patient either. They think it's just for top athletes. But what an ART provider will do is he'll go through and release all these different entrapment sites that there can be. There's more than this, but these are the more common ones. And he'll release the scar tissue from around the nerve. Usually nerves slide freely within the soft tissues, and in the case of the ankle here, if I move the ankle up, the tibial nerve should be sliding downward. If I move it down, it should be sliding this way. And if you don't have that relative slide between the tissues, then you're going to have sciatica symptoms. Same goes for all these different areas. So please try an active release technique provider. Most people find a significant decrease in their symptoms within 3 to 4 treatments. If you don't, usually they'll refer you out to the appropriate specialist because it could be something that ART can't fix. We realize ART can't fix everything, but we see such phenomenal results with many different types of injuries that we at least like to give it a first try before any operations. Surgeries, like I said, most people don't need them, but some people do. But fact is, if you're unsure about it, whether you want surgery or not, try out active release technique, because after you have a surgery, you can't go back. If you're not happy with the results, then there's no going back. Your body's changed forever. If you'd like more information on active release technique, please visit my other demonstrations or visit my website. If you'd like more information on how to find a provider in your area, there's the Head ART website called www.activerelease.com. I'm going to show you a little bit of what you should expect when you come into an office to receive active release technique. Just remember that active release technique is totally different from chiropractic or massage therapy. A lot of massage therapists, chiropractors, and some MDs do this technique, but it's totally different from the profession that they usually work with. So because I've had a lot of people that are skeptical about coming, they're like, I don't want to get my neck cracked. And you're not going to get your neck cracked. So if there is any adjustment, it's incidental from the movement of the body during the treatment. So let me just show you here. This is in regards to sciatica. So right now I'm just going to free up the sciatic nerve from the surrounding tissues of the piriformis and all the external rotators of the hip. Very, very common entrapment site. Probably most people with sciatica will have this. You just barely touch them right there and they're going to feel, wow, that's my spot right there. Next spot is the hamstrings. Head forward, come back. Straighten this knee. I'm just going to show you this one area of the hamstrings, but obviously it can be entrapped all the way here. Head forward. It goes right between the hamstrings, all the way down into the knee. Next spot is very common as well. It's the tendinous arch of the soleus. Forward. Okay, so all these spots can clinically present as sciatica. Please visit my website for more informative articles about different injuries that can be helped out with active release technique. A lot of people don't know that it can help out with multiple things. You know, pretty much everything in the body can be helped out with active release technique. But please check out those articles. Also, there's the ART website. There's a lot of informative articles on there as well.